Welcome to CCK Live. My name is Kayla D'Onofrio. I'm joined today by Frank Padula and Matthew Fusco. And today we're going to be discussing what veterans should expect at a VA compensation and pension exam. A compensation and pension exam, or a C&P exam for short, is a medical examination of a veteran's disability that's performed by a VA contracted provider. VA uses C&P exams to gather more evidence on a veteran's claim condition before they issue a decision and assign a rating. So VA will specifically use these for two primary reasons. The first is to confirm or deny service connection, meaning that they're looking to confirm that you have a disability and that it's related to service, so usually providing that nexus element. And the second is to establish the severity of a condition, looking at the symptoms, the severity, and how they align with the rating criteria for that disability so that VA can assign an appropriate rating. Since medical evidence is crucial to a veteran's disability case, C&P exams are provided by VA at no cost to the veteran, and this is part of their duty to assist. And I just want to make a note that medical evidence, but specifically C&P exams, are one of the primary things that VA is looking at when they are adjudicating claims. And if you are scheduled for an exam, it is really crucial that you do attend the exam. If you don't attend the exam, it is a reason that VA can use against you to deny your claim or deny you an increased rating. So if it is scheduled, we really do encourage veterans to attend them if they can. But Matt, how does VA go about scheduling exams?
Sure. So after applying for disability compensation, VA will send a notice either informing you that an exam has been scheduled or indicating that you will need to schedule an exam on your own behalf. If the exam is already scheduled for you, VA will provide you with the date, the time, and the location that it will take place. And on the flip side is if you are responsible for scheduling the exam yourself, you're going to want to respond promptly by reaching out to the compensation and pension department at the VA in order to get that exam scheduled. Either way, no matter how it's scheduled, if it's for you or if you're scheduling it yourself, it's very, very important to attend C&P exams once they are scheduled. We can't underscore this enough. If you do not attend your compensation and pension examinations, there's a high likelihood your claim will get denied because of that. So we really want to stress the importance of attending all C&P examinations that you are scheduled for.
Thanks, Matt. And what can veterans reasonably expect to happen during an exam, Frank?
So during the exam, the examiner may physically examine the veteran and or ask questions about the veteran's service, their disability, and the connection between the two. With that being said, it can be helpful for veterans to go into the exams prepared to talk about their symptoms and how those symptoms affect their day-to-day life. It's also important to mention that prior to the exam, the examiner will review the veteran's claims file, so they're familiar with the case. And along those same lines, VA examiners might complete a disability benefits questionnaire, or DBQ for short. And each DBQ is drafted to correspond with a specific disability and is formatted for examiners to check a box on the form next to descriptions that most accurately depict that disability in question. These exams can last anywhere between 10 minutes to an hour long, maybe more sometimes. But if the exam is very brief, you might not have enough time to present the examiner with the complete picture of your disability. With that being said, it might be helpful to take notes during your exam, just to document its brevity and to note whether or not you were able to sufficiently describe your disability to the examiner.
Yeah, that's a really good point, Frank. There's a lot of different things to sort of keep in mind when it comes to these C&P exams, to include the fact that they're just not always as helpful as or thorough as we would hope that they would be. So a couple of other things to consider when attending the exam is just really being honest about your symptoms with the examiner. So that means don't downplay your symptoms, but also don't over-exaggerate your symptoms. If you over-exaggerate your symptoms, VA will call this malingering, and they'll use it as a reason to deny you. And similarly, if you downplay your symptoms, it'll sort of allow VA to assign you a lower disability rating than may be accurate to the symptoms that you're experiencing. So to that end, if you are someone who does not normally get dressed up or showered or shaved daily, then don't show up to your exam that way. Show up the way that you would look on any given day based on how your condition impacts your mental or your physical abilities. An examiner's impression of you will be reflected in their report. There is usually a section in their report where they sort of describe your general appearance, your demeanor. So all of this will be reflected in sort of an objective view from the examiner. And if you tell the examiner that you have trouble getting motivated to take a shower or to shave, and then you show up looking like you're headed to a job interview, this may give the doctor the impression that you're over-exaggerating your symptoms when you're reporting them. Other things that you might want to consider including in your exam is bringing a friend or a family member to your exam, especially if there's someone that you maybe live with or you spend a lot of time with and they witness your symptoms on a regular basis and how they impact your daily life, or if there's someone that assists you with kind of moving through your day-to-day activities. It can also be really helpful to bring a notebook or a phone with notes detailing your symptoms, your flare-ups, your other struggles so that you don't forget anything when the examiner asks. I know it's super common to get sort of anxious before these exams, and that can definitely lead to forgetting symptoms, or your disability may cause some memory impairment. So it can be really helpful to just have that written down and ready to go for when an examiner asks. Matt, what can veterans expect to happen after the exam is completed?
So after the exam, the examiner is going to write up a report that includes a review of the exam's findings. This might include any clinical test results, any medical literature used by the examiner to determine the etiology or the cause or origin of a disease or condition. If the examiner is trying to confirm or deny service connection, they're going to write up a medical opinion that states whether or not it is at least as likely as not or 50% chance that your disability was incurred in or aggravated by your military service. The C&P exam, once it's completed, is then added to your claims file as part of the evidence VA will use to make a decision. But we just want to note that while C&P exams themselves do carry a lot of weight in the claims process, the examiner completing your C&P exam is not the individual who is going to issue the final decision on your claim. That will be someone, an adjudicator at the VA, not the medical examiner themselves. So that distinction is just important to understand.
Yeah, absolutely. Thank you, Matt. And Frank, are veterans able to get copies of these exams once they are completed?
Yes. So veterans have the right to request and obtain a copy of their exam from VA. VA does not issue the veteran a copy of the report unless they specifically request it. You can send a letter requesting a copy of your exam report to your regional office. And if desired, you can also request your examiner's credentials just to ensure that they were qualified to evaluate your disability. And as mentioned before, VA decision makers often place significant weight on these exams when deciding claims. That means it's really important to review the exam to determine if the results were favorable and ensure it was filled out completely and thoroughly and reflecting the most accurate information possible.
And what should veterans do if they don't agree with the exam results? I think we've all seen plenty of exams that are not great quality, they're not thorough. So what options do veterans have if that's the case?
Well, if they disagree with the exam results, they could consider disputing or countering the examiner's report by doing a number of different things. They could gather additional evidence, such as buddy statements and lay statements. They can ask their own doctor to fill out a DBQ or write a medical opinion for them. They can request a hearing with VA, or they can hire an accredited representative to assist you with an appeal or help gather that additional evidence that I just mentioned.
Yeah, that's really good points. These, like we've said time and time again, these exams tend to not be great, and it is something that VA relies on heavily. So if they're not the results that you were hoping for, or they're not super supportive, you're not necessarily stuck with that, and you can definitely give other evidence to VA adjudicators that they can consider before they make a decision on your claim. But I think that's really a good place for us to wrap up today. Thank you all so much for tuning in. Be sure to check out our blog for more detailed information on the topics discussed in this video, and also subscribe to our channel to stay up to date on the latest veteran-related news and insider tips.